My journey's been a long one in that I have been suffering from this pain for at least 5 years. I did have an initial surgery on the knee, which only lasted a couple years, let's say 2.5 years, and I've continued to work, and the pain just got so bad that I knew that I needed to do something. And I don't have insurance in the United States. A surgery of this type costs thousands and thousands of dollars, and I knew I couldn't afford that.
In order to have a total knee replacement in the United States, it was just really cost prohibitive. So we started looking to other locations, India in particular. One thing that kind of directed me to Fortis was the fact that they had the International Joint Accreditation, which I found to provide some confidence in the hospital. And further evaluated the various doctors and the options at the hospital and found Dr. Hulse. Really liked his background because he had some international experience. Was able to contact him directly and ask him questions about Pam's condition. So I really felt very comfortable with the communications, with his experience, and with the hospital. I did research on patient feedback, both from Dr. Hulse and the hospital, which gave me a high level of confidence. I further asked Dr. Hulse for some references in the United States that I was able to speak to, where he had performed surgery on family members, and all that was very positive.
She had a deformity in her knee called flexion deformity, which is about 60 degrees. That's why she was not able to straighten her knee at all. That has made walking very difficult. When I saw her, she was actually wheeled into my consultation room on a wheelchair. She was in a lot of pain, and she was not able to walk, and X-ray showed a lot of wear and tear inside her knee. So the difficulty was to correct the bent in the leg and also give her a knee replacement.
Everything was explained to me beforehand what was going to happen, and I felt very comfortable with Dr. Hulse and his staff. And so they did the surgery. The surgery came out very, very nicely.
We used a technique called computer navigated knee surgery. This surgery helps us to get the leg alignment accurate to an extent to a 0 degree, and also it will help the accuracy of component position of the knee replacement. Operation went on well. She underwent good physiotherapy after the surgery. So she recovered very well, and she has been mobilized very well after the surgery. In fact, on day 6 she was discharged, when she is able to do her normal activities, able to climb stairs, and I'm sure she will do very well, in terms of the recovery.
Pam has now had the surgery. She's been able to walk, and I feel that moving forward, going back, she'll recover totally. And it just wouldn't have not been possible to get that surgery done without coming to India, just because of cost alone.
I had no idea how many positions what our knees really did for us. They do a lot of stuff, so they've covered all their bases on movement and pain control. And the staff here at Fortis has been amazing. They've ingratiated themselves in my heart. They have not denied a single thing I have asked. Dr. Hulse has been in to check on me every day, sometimes 2 days, to check on me, make sure that I'm okay. And I'm really appreciative of that.
I guess my advice to other patients is, you have to be comfortable, with the travel and going to, I guess a country with a different culture and a different language. Everyone here is spoken English. I know India is a little rough, but I found at the hospital itself, once you get inside the hospital, it's comparable to what I would expect in Western standards in terms of the medical care. So we felt very comfortable. So just do your homework, and for us it's been a good thing. I felt very good about it. Did a lot of research. I'm an engineer, so I dig into a lot of details when I do something, and we've just felt very comfortable with the decision we've made.